Hello, good afternoon. You're welcome again to this lecture this afternoon on healthcare information system. Last week, we were fortunate to know what healthcare information system means, and we go into the benefits of health information. We also talk about the functions of health information system. So we also talk about the features of health information system last week. We rounded up in basic applications of surveillance. So today, I would quickly want us to note these three terms used in the documentation applied in describing infectious disease warning. Terms used in the documentation applied in describing infectious disease warning. We have three major terms. Number one is early warning. Number one is early warning. Number two, early warning system. Early warning system. Number three is prediction. Prediction. I will quickly explain or define all of these three terms used in the documentation applied in describing infectious disease warning. What do we understand what do we need to understand by early warning? Early warning refers to infectious early warning based on quantitative data analysis. Early warning generally analyzes surveillance information. It is an information given on timely basis as against an outbreak of diseases. That is what we refer to as early warning. It is based generally on surveillance information. It is given timely as against an outbreak of disease. Now, what do we need to know, or how do we define early warning system? Early warning system is an essential component of public health emergency work. It is an essential component of public health emergency work. That is early warning system. It is a way of bringing about early warning signs to people. It is a method applied. That's why they call it early warning system. A method applied in giving warnings as against an outbreak. Like, for example, we are having coronavirus globally, coronavirus disease globally. There are daily warnings as to what we must do to protect ourselves. You see, so that is an example of early warning system or early warning, whatever you can call it. But it's a system applied. It's a method applied. It's an approach in giving an advice as against an outbreak of disease. Now, early warning system has 4 characteristics. Early warning system has 4 characteristics. Number 1, surveillance information. Number 2, it is timely. Number 3, it aims at providing evidence. It aims at providing evidence. Number 4, information inadequacy. Information inadequacy. Let me explain. Surveillance information is a way of giving information on the occurrence based on timely and accurate surveillance data. It's an information on the occurrence which must be based on timely and accurate surveillance data. That is number 1 characteristics. Number 2, which is timeliness. I made mention of timely. Nearly essential for, is very essential for disease early warning to be timely in its detection. It is very essential for early warning to be timely in its detection and warning during the early stages of outbreak. That is, one must be time conscious in giving warning signs to the population on outbreak of diseases. It is very essential to give warning signs on any outbreak of disease. Number 3, which is information for action. As the name implies, as the word implies, information for action. It aims at providing evidence-based guidance resulting in an informed and targeted response for the purpose of controlling the outbreaks, or at least ensuring they are reduced to a minimum. Let me explain this. The information that must be given out must be action-based, must have evidence. If people are carrying out information on coronavirus, there must be evidence. Before now, as at in the last 1 month, people do not really believe that coronavirus is a disease globally. We were just hearing it. People were just carrying rumors. Not until now, when they begin to see curfew coming up, shutting down all over the places. It is now people now begins to know and believe that there is a virus going around the world. So there must be an information with evidence-based. So it's also a characteristic of warnings, early warning system. The last one, under the characteristics, we have information inadequacy. Information inadequacy. There is no amount of information that will be given. It will never be adequate. Not everybody will get link to such information. Only few will quickly get such information. Only few will quickly capture such information when it comes out. That is why in every outbreak, in every epidemic, the information is always inadequate because it may not really go out. I mean, it may not really go out to everybody at the same time. So another term that is used in documentation, applied in describing infectious disease warning, which is number 3, is prediction. Prediction. Prediction is a notion closely related to early warning. Prediction is a notion closely related to early warning. Okay? And when we are talking about prediction, it is also characterized by 2 major things. Number 1, speculation. Like I said, it's a notion closely related to early warning. And it is also characterized by 2 major things. Number 1, speculation. Number 2, the description of uncertain events in the future. The description of uncertain events in the future. That is, they will begin to describe events that are uncertain in the future. In the process of one, it has to do with future occurrence. And it is full of speculation. So I've made mention of 3 major things now, major terms applied in infectious disease warning. Early warning system, prediction. I said early warning has to do with analysis, with analyzing surveillance information. And I said the early warning system is an essential component of public health emergency work. And it has its characteristics, which I've just mentioned. And I made mention of prediction also as a notion that is closely related to early warning. And it is also characterized by 1, speculation, 2, the description of uncertain events in the future. The description of uncertain events in the future. Now, prediction has basically the same meaning as forecast. It is just like you are forecasting what is going to happen in the future. It's like somebody or an analyst or a scientist telling us what is going to happen in the future. So it is like a forecast. Prediction is like a forecast. The only thing is that it stresses the expressed publication of various predictions. But don't bother yourself with that. Just understand it this way, that prediction has basically the same meaning as forecast. Okay? Just understand it that way. So we've been able to look at the 3 terms clearly. Now, what are the concepts of early warning and prediction? What are the concepts of early warning and prediction? I want you to understand this very well. What are the concepts of early warning and prediction? Good. The two concepts are interconnected. The two concepts are interconnected. Why? Because they both serve to describe future events. They are both talking about future events. Okay? They are talking about future outbreaks. They are talking about how to control it based on existing facts. So early warning can be seen as a special type of prediction or a special application of prediction technology. I repeat, early warning can be seen as special type of prediction or a special application of prediction technology. Okay, I think we can move forward now. How do we now compare between the two concepts? How do we now compare? So we are going into comparisons now between the two concepts, between early warning and prediction. Early warning and prediction. Number one, early warning emphasizes detecting possible or ongoing events and issuing of warning messages. They emphasize on detecting possible events and issue warning messages. What happens to prediction? They describe events that are yet to occur. I repeat, early warning emphasizes detection of ongoing events and they issue warning messages, while prediction describes events that are yet to occur. They describe events that are yet to occur. Okay. Secondly, early warning makes judgments regarding a specific event. They make judgments regarding a specific event, while prediction focuses on estimating and measuring short, medium, and long-term trends rather than a particular event. Prediction focuses on estimation and measuring, while early warning makes judgments regarding a specific event. Okay. Early warning results are used to guide timely responses. They are used to guide timely responses to ongoing outbreaks or possible outbreaks, while prediction results are used to develop infectious disease control programs or plans. I repeat, early warning results are used to guide timely responses to possible or ongoing outbreaks, while prediction results are used to develop infectious disease control program or plans. Lastly, early warning methods are based on easily available and limited information. Easily available and limited information, and it leads to qualitative results. While prediction is more extensive information, more extensive information can be used to build more complex forecasting models. More extensive information can be used to build more complex forecasting models. That is, prediction results can be described, can be presented qualitatively, but are usually expressed quantitatively. I repeat, early warning methods are based on early and easily available and limited information, and it leads to qualitative results. While that of prediction, they have more extensive information which can be used to build more complex forecasting models. In other way, the results can be presented qualitatively, but are usually expressed quantitatively. Okay? So right now, I think we've been able to look at the terms that are generally used in documentation when applying descriptive, when describing infectious disease warning. We've been able to define the two major terms, early warning and prediction, because early warning system is just a system applied. But early warning and prediction, and we've been able to make a comparison, and we have 4 comparisons each. Areas where you can majorly see the difference between early warning and prediction. And we've defined prediction also. It has its own characteristics, and early warning has its own characteristics. And we have talked about the concepts of early warning and prediction. So I think we are having just 16 minutes more to go. Maybe we'll just go into an introduction, then with introduction to Excel, then we stop here for today. Introduction to Excel. Introduction to Excel, EXCEL. So healthcare is probably the most complex industry, so its data is very hard to handle. I repeat, healthcare is probably the most complex industry, and so its data is very hard to handle. How? Reasons why it is very hard. You must know it as healthcare management and managers. Number 1, the data is not joined. There is no adjoining data. You cannot join the data in Earth. Every data in Earth stands on their own or on its own. Number 2, payroll and scheduling is done. They schedule their program. Number 3, they want to talk about revenue analysis. They want to analyze their revenue, their means of income. Then, I think the last one under the reasons, is data cleansing. You want to cleanse your data. You want to be sure of what you have in and out. So Excel can solve this problem. Excel can solve this problem of data in healthcare management system. I want to give room for question at this moment because we are having less than 15 minutes more to go. We are having less than 15 minutes more to go.
Students, you can unmute yourself and ask your
So question. It is time for questions.
Unmute yourself on the mic the mic symbol on your phone and you'll be unmuted. Thank you.
So I want to ask, my name is Isdra, sir. Hello, good afternoon, sir. Good afternoon, sir. Hello, good afternoon, sir. Good afternoon, sir.
Go
Hello,
ahead. Good afternoon.
good afternoon, sir. My name is Isdra, sir.
Go ahead.
I
Can hear
I
you.
want to ask, sir, are we going to get this material after the class? Hello, I'm not hearing anything again.
I guess your please hold on. I guess your lecturer is having some network difficulty.
Okay, okay.
Hello.
Hello, sir. Hello, sir.
Keep patient. Your lecturer will be back. I think he's having some network difficulty.
Are you hearing me?
Yes, sir.
Yeah.
I can.
Do you hear me now?
Yes, sir. I can hear you.
Yes, go ahead with your question.
Sir, I wanted to ask, is it possible for us to get the material after the class?
It's possible, but I think it's showing in your screen.
Yeah, some of us are not able to get everything in detail. So,
But you are listening to me.
Yes.
I can assure you, if you really listen to me, the way I'm taking this lecture is to make it very easy for you.
yes, sir.
Even if you get the material and you are reading it, you may not get
Yes,
some points that I'm bringing out.
Yes.
yes,
Do you understand me? If you
yes, sir.
can listen to this lecture very well, even if you don't have the material, I can assure you, you will pass my exam.
Yes, sir.
Do you understand? Because
Yes,
even in the material, there are some things you may not see easily when you are reading it. Are you okay?
Yes, sir. I came in late because of network issues on my phone, so I couldn't get the whole topic. So that's why I'm asking for the material. So I don't
Anyway,
know
I
if that
can
will be
quickly give
possible.
you a summary. We've just
O-
talked about some terms that are used
Okay,
in documentation when describing infectious diseases. Okay?
okay,
And we have just
okay,
talked
sir.
about early signs and
Okay, sir.
prediction. Okay?
Okay,
So
okay, sir.
early warning and prediction. And I said early warning generally analyzes surveillance information.
Okay,
Okay?
yes,
And
sir.
why prediction has to do with future occurrence. It's like
Okay,
you are forecasting. You
yes,
understand?
sir.
Like you are forecasting future events. So that's just a
Okay,
summary of the whole thing.
okay, sir.
All right.
Thank you.
Okay. Any other question, please?
Our assignment, the one you gave to us, when are we submitting it?
You can submit, since the school did not give us a general email for submission. I think you can use my email tentatively.
Okay, sir. All
Do
right,
I
sir.
give you?
Yes, sir.
Okay, SA Akoro. Just write
Yes.
SA. Are you noting it?
Hello?
SK.
SAAKORO. SAAKORA. I mean RO 1 at gmail.com.
Please, sir, I didn't get that. Please, can you recap that, sir?
SAA. That is 2A.
Yes.
SAAKORO. Then you put 1.
You put what?
One.
SAAKORO 1 at gmail.com.
So I want to get to the L. Is it for Lima? That is L for land, or S?
SAA.
Okay, S for
SAA.
Syria.
Yes.
S.
SAA. Like
Okay.
ABC. SAA.
Okay.
KORO 1
Okay, sir.
at gmail.com.
Okay, sir.
Okay. I am listening to more questions because I think we are still having about 7 minutes. Yeah.
Hello, sir. Good afternoon, sir.
Good afternoon.
Yeah, this is Regina.
Okay.
Yeah, so when you talked about the 3 major
Yeah.
terms in documenting an infection disease, you talked about 3,
Okay.
which are early warning
Yes.
system, and predictions. But you only
Yes.
emphasized. Hello, can you hear me?
I'm hearing you.
But you only
I'm
emphasized
hearing.
on 2. You only emphasized on 2, which are early warnings and prediction. Are you saying the
Yes.
early warning system doesn't really have more?
The early warning system is
Yes.
an approach to early warning.
Okay.
Early
Okay.
warning, when they ask you differentiate between early warning, and early warning system. So the system
Okay.
is just an approach to early warning.
Okay.
It's just an
All right.
approach. It's just a way of coming about giving warnings. You understand? That is why I
Yes,
lay
sir.
much emphasis on early warning and prediction. And you can even
All
see
right.
from the comparisons.
Yes. Yes.
You see it from the concept. Do you understand?
Yes, sir. Very well, sir.
Okay.
Yeah. Thank you very much.
All right. There's still room for questions. We still have about 5 minutes to go.
So what I want to
Hello.
ask, you said Excel. You talk about
Excel,
Excel, sir.
introduction to Excel.
Yes, the Excel, is it a normal computer application that we use for
It is
recording
a
or
computer
statistical?
application. It is a
Okay.
computer application. No, we are talking about health information.
Yes, sir.
There is no way you can operate as an healthcare manager without knowing about the computer to some extent,
Okay.
because you want to
Okay, sir.
gather information, you want to document information. You understand? So you have to know something about Excel, how to input some things. And
Okay.
it is the most complex healthcare. Healthcare is the most complex industry in the world, and so it's difficult for them. Data is hard to handle for healthcare people, very hard to handle. And I gave us the reason. Number one reason is that you cannot join data in
Ah,
healthcare. You understand? You cannot
yes,
join
sir.
data. You cannot mix the data for TB together with that of HIV. You cannot mix the
Ah,
data for coronavirus with influenza. You understand?
yes, sir.
So in health, you cannot mix data. You cannot join them. So, and the payroll and schedule, you cannot do the thing together. Then revenue analysis is also a reason, and data cleansing. So those are the reasons why it is difficult or hard for data to be handled in healthcare management.
Yes, sir.
Any other question, please? We
Hello,
still have
sir. This is
yes,
Yeah, this is
yes.
Regina again, sir. Please, when you were
Okay.
trying to when you were differentiating between, or the comparison between early warning and prediction, the first one you said that concerning early warning, you said detecting early warning events and issues they are yet to occur. That's during early warning, but I didn't get the one for the prediction.
For prediction, you know, for early warning, it emphasizes
Yes.
on detection of ongoing events and the issue
Yes.
out of warning messages. For that of
Yes.
prediction, describes events that are yet to occur.
Okay.
Can you get the difference? Now, the second
Yes, sir.
point there, early
Yes.
warning makes judgments regarding
Okay.
a specific event, while
Okay.
prediction focuses on estimation and measurements.
Okay.
Okay?
Yes, sir.
Number three, early warning results are used to guide timely responses to possible or ongoing outbreak, while that of prediction are used to develop infectious disease control program or plans. Okay? Then the last
Yes, sir.
point there, early warning, the methods are based on easily available information and it leads to qualitative results. While that of prediction is more expensive, the information is more extensive, and it can be used to build more complex and forecasting model. That is, the prediction results can be presented qualitatively, but are usually expressed quantitatively. Can you get the
Yes, sir.
difference?
Yes,
Okay,
sir. Yeah, thank you.
all right.
Yes, sir.
Uh, do we still have any question before I throw this question generally? Do we still have any
No question.
question? Okay. I assume there's no more question because of our time. We just have 1 minute to go. Okay. Anyone, this is an assignment now.
Okay.
Anyone can be seen as special types of prediction or a special application of prediction technology. Discuss.
Sir, please recap.
Early
Hello.
warning can be seen as special types of prediction or a special application of prediction technology. Discuss. Do you get it?
Yes, sir.
That's just the assignment for now.
Okay.
Okay, sir.
Early warning can be seen as special types of prediction or a special application of prediction technology. Discuss.
All right, sir.
Thank you so much.
Thank you, sir.
Yeah. Thank you, sir.
All right. Thank you so much.
Yes, sir.